For individuals that have type 1 diabetes and for individuals that have type 1 diabetes that are pregnant, exercise is something that needs to be considered very seriously when we're giving an exercise prescription for these individuals, because these individuals typically are using a considerable amount of pharmacological intervention through insulin. And so we want to make sure that we are balancing what that exogenous insulin is doing and what exercise as an insulin sensitizer is doing as well. If they're not already exercising, a really strong conversation as to how often they check their blood sugars and what they're going to do if they start seeing their blood glucose drop. Those are very important conversations. And here on this slide, you can see what's happening when somebody is taking insulin, what we would expect. Versus an individual that is exercising and they have to decrease their insulin to really kind of get the same effect and safely get the same effect. What's really important is to have them not only checking their blood glucose, but also to make sure that they're checking their ketones. And I'm going to go through some of the acute and chronic recommendations, acute exercise and chronic exercise recommendations for these individuals as well. So getting clearance, it's very important to work with the OBGYN and their physician, understanding what types of risks they may have and where they are in their progressive diabetes. If they don't have diabetes at all, understanding what other comorbidities they may have or risks they may have that might limit their exercise. So safe exercise is the ultimate goal. Getting medical clearance to emphasize to the patient that the importance of cardiac assessment to determine the presence of any pathologies is very important, and especially we want to know about the chronic complications. If individuals are older than 35 years of age, we recommend that they get a stress test along with a 12-lead EKG, and that be read by a certified EKG assessor, which is usually a cardiologist. Individuals that have type 1 diabetes and have had it for greater than 15 years, or they're older than 30 years of age and have been diagnosed with type 1, also will need this test. So again, that's a stress test with a 12-lead EKG and to be cleared by a physician. Some of the acute complications that can occur and how we want to treat them are important to know about. So exercise-induced hypoglycemia is number one, meaning there is an incredible insulin sensitivity effect from exercise, and the insulin plummets. So how do we be prepared for that? Well, again, having them check those blood glucose levels very frequently initially, when they're just starting to exercise, so before, during, and immediately after, and then even 2 and 4 hours after to see what's happening, is going to give you, the practitioner, a lot of help to better help them with their exercise prescription, and it's going to empower them to really see the powerful impact of exercise. Again, modifying their food intake, and sometimes we see exercise responding as an appetite suppressant. And that happens, it's really important that they realize they're changing the impact of the amount of food they're taking, and therefore they're changing their blood glucose, and they might need to adjust things accordingly if they're taking any kind of pharmacological drugs as well. Adjust insulin levels accordingly, and then avoid exercise at peak times, and peak meaning peaking up high, but also dropping down and spiking down low. So if they know when those peaks and dips are, and they can realize that it's probably not a good time to exercise when they're up high and they're dipping down low. And then, of course, always carrying fast-acting carbohydrates, injecting insulin into less active sites, especially if they're going to be doing large muscle group activities such as walking or even squats or lunges, so maybe not actually doing their insulin injections in their hips, their buttocks area, but rather doing it in the arm during those times. Further strategies to avoid any worsened metabolic status. If their blood glucose is greater than 250, this is an absolute necessary time for them to check their urine ketones. If it's negative, they can proceed with exercise, but they'll want to recheck the blood glucose and urine ketones after they're done exercising, immediate and 2-hour post. But if it's positive, this is really important for them to not engage in exercise, but to to seek help and understand what is actually happening and why they're spilling ketones. If they can adjust with carbohydrate, this is really doable most of the time for them. So if it's moderate to high intense exercise, 30 to 60 minutes, they would want to supplement with 15 to 25 gram carbohydrate per session. Supplement with carbohydrate if exercise lasts longer than 60 minutes, and they'll want to have it with them during that time. So they'll actually want to be consuming something. If they're exercising for 90 minutes, they want to be consuming something while they're exercising. And then always keep fast-acting carbohydrates available, of course. So I'm just going to briefly touch, obviously there's a lot of information that we can talk about with chronic complications, but I think it's just really important to kind of briefly go over these. So cardiovascular exercise, cardiovascular disease and exercise go hand in hand. In fact, those who have cardiovascular disease should be exercising. Individuals that also have a complication of obesity or even overweight and obesity and have hypertension can also benefit from exercise. So again, baby steps are really important, helping them to understand when their blood pressure, systolic blood pressure in particular, is greater than 180, this is a time not to exercise. So they want to make sure it's below 180. And decreased pressure responds to their vascular wall, so it improves the vascular tension. Monitoring, so again, their heart rate reserve, we look at their intensity of 40 to 80%. This is usually a 15 to 60-minute prescription we give them, and we start around 3 days per week. I'm going to kind of pick up speed here. Peripheral vascular disease, aerobic activity is as tolerated to the point of ischemic discomfort. Use intervals equal or longer than rest. So basically what that means is that you'll exercise for 5 minutes and then you'll take a break for 3, and then you'll exercise again for 5 minutes and take a break for 3. And you can close that gap over time. Using the rate perceived claudication cane with each workout, that's really important as well. And then extend work time and decrease rest time as one starts having exercise become habitual. Nephropathy, incipient nephropathy, decreasing heart rate intensity to 40 to 60%, and end-stage renal disease, just making sure that the exercise is not at a high intensity. Their work heart rate is 20 to 30 beats lower than their resting heart rate, and the exercise is aerobic in nature. And then retinopathy, I am going to just spend a little time on this because this is a really important one, especially for individuals that are type 1 and pregnant. Dangers of exercise increase systolic blood pressure with subsequent vitreous hemorrhage, so further reduction in the already compromised circulatory oxygen levels. They need to start at a low intensity, and they would need to make sure that they are upright. They don't put their head below their waist. They avoid any vigorous bouncing or any jarring, any stop and go, really drastic exercise, and any strenuous upper body exercise like rowing or arm ergometry. We do see in these individuals improvement in hormonal levels and also HDL cholesterol, positive retinal microcirculatory changes, and improved blood glucose and positive peripheral adaptations if it is done in a stepwise process. Okay, so peripheral neuropathy and autonomic neuropathy in exercise, non-weight-bearing activities, and this ideally is basically a buoyancy environment. So any kind of exercising in the pool is ideal for individuals that struggle with this complication. Prudent habitual foot care practices are required to reduce risk or ulcer. Activities which require skill and coordination aren't tolerated. And so autonomic neuropathy, pre-exercise testing with Valium and a CAT scan, screen for orthostatic hypotension prior to exercise, encourage long warm-ups and long cool-downs to really get that body into getting the circulation moving. Maintain low to moderate intensity, and this individual may actually need to have a co-exerciser that is really looking out for them. So the last few slides here, I think I only have 3 more, are just a quick touch on how to do an exercise prescription. The FIT principle is a really ideal way because it's easy to remember and you really do cover all 4 aspects of an exercise prescription. So F is for frequency, I for intensity, T is for time, we use duration, so how many minutes, and then T is for type, or what we also call mode. So walking or going for water aerobics, or that's what the mode would be. And then incorporating aerobic, anaerobic, and flexibility. The intensity, they need to be taught how to take their their heart rate. Largely, many individuals aren't sure quite where to find their carotid in their neck or where to find the radial artery in their arm. So taking a minute to kind of help them find that pulse. And then I suggest the Carbonin formula, where you're taking 220 minus one's age, and then you're simply multiplying it by 60% to 80%. Now, based on the chronic complications of somebody that may already have pre-existing diabetes, you might want to drop this down to 40 to 70% or 40 to 60%. If they don't feel that they have a good handle on doing this kind of calculations, you can also tell them to think about doing a sing or a talk test. And if they can't talk while they're exercising, it's too intense. We also can recommend using the perceived exertion scale. And this is basically on a scale of 1 to 10, how do you feel? Are you like halfway there? Are you at a 7? Are you at an 8? Are you at a 9? And people that are up at the 8 and 9, they're pretty much at their full capacity of exercising for 20 minutes. So we'd like to see people typically around a 6 and a 7. And then lastly, how long? Well, baby steps are very important. You can start them at 5 minutes, and some individuals, I have them walk around the dining room table 20 times, and that's about a 5-minute exercise, and they just increase upon doing that. But baby steps are really important with the duration, and the goal is really getting them to be very consistent for 5 days a week to 20 to 40 minutes. How often? 3 to 5 times per week initially, and then getting them up to 5 to 6 times per week.